800 healthcare workers across the province face reprimand for that one-day wildcat strike last October. Labor experts calling the move unprecedented. Alberta's largest union, AUPE, which represents more than 90,000 workers, including 58,000 in healthcare, have filed nearly 800 grievances after their members received letters of warning and 27 suspensions from work ranging from 1 to 5 days. AHS also reported 8 licensed practical nurses to their professional body. In a statement, the union writes AHS has created as many grievances from one day of protest as they would normally face in 2 years from AUPE.
That number was quite jaw-dropping.
This labor expert says normally only the union or ringleaders are penalized, not hundreds of workers. He says this move sends a clear message.
What we know about this is bad human resources strategy. It's just a bad human resources practice, which means what they're really doing here is trying to send a signal to other public sector unions that we're going to come down hard.
Adding that this could add more fuel to the fire.
Which is going to rile people up. It's not going to stop a single union or a single public sector worker who thinks that their job is under attack from doing something like this in the future. It's going to be completely ineffective at stopping what they want to stop.
Alberta's official opposition, meanwhile, slamming the government, calling the move hypocritical.
As people go in, break public health rules, gather together indoors without masks, too close together, putting the very lives of people in their community at risk. And Jason Kenney will not even ensure that those folks get fined a few $100s.
AHS released a statement to City News. In advance of the strike, AHS has communicated to staff and AUPE that it would be pursuing action on any illegal activity, and staff would not be granted amnesty. As part of the investigation, staff across all zones were determined to be participants, instigators, or organizers, and disciplinary actions were issued as appropriate based on role and impact to patient care. Last October's illegal strike was held after the government announced plans to cut 11,000 jobs, privatizing many of them. In Edmonton, Rochelle Soufi, City News.